So this is for all you nurses, student nurses. Gonna talk about starting IVs, what they don't teach you in school. Now I know in school they teach you how to put on a tourniquet, how to look for the vein, and feel the pop, or however your school teaches. But what they don't teach you is how to approach the patient. When I get students, they feel confident because they can get it in school, but when it comes to starting IVs in real life, they get nervous. I think 80% of starting an IV is the attitude you bring to the patient and the vibe you bring to the patient. If you come to the patient's room all nervous, like, my name is John, sir, and I'm gonna start an IV, I'm telling you, man, your patient is gonna be like, what the hell? Are you good at this? You better get it on the first try. I don't want you poking me more than once. How long have you been doing this? Can you get somebody else to start an IV? And my advice to a lot of the nursing students is always the same. You gotta be like a swan, because you gotta be calm and collect on the surface, even though underneath you're like pedaling like crazy, just pedaling. If you come into a patient's room being confident, patients usually will feel that vibe. They'll let you usually start an IV. They're like, oh, okay. And sometimes you just gotta you just gotta grab your balls, go into the patient's room and just be like, hello sir, my name is John, I'm gonna start your IV. No ifs, ands, or buts. The trick is to be bold and humble. You don't want to be bold and arrogant, because ain't nobody gonna like you. Probably one of the scariest things about starting IVs is starting one on a child. I remember my preceptor, the one that was training me, she was like, hey, you're gonna get this IV, right? I guess, I'll try. I will never forget, she looked at me and she said, you can't guess, you have to know you're gonna get it. And then I asked her, well, what if I miss? And she looked at me and she said, you're not gonna miss. I went in there, I was like, man, I'm gonna get this, I got this. Just being confident, being bold. I went in there, I said, hey mom, gotta start an IV on your child. Just give us a minute and we're gonna start it. I remember I put one in, it was successful. I was like, dang, it makes such a big difference when you go in there with such confidence, knowing that you're gonna get it. And no, I know, some of you are gonna say, well, what if I miss? Well, you know what? You go in there knowing you're gonna get it, and if you miss, you poke them again. Because come on, let's be honest, nobody starts an IV just to miss. It's not like I'm gonna poke you just to miss. In the beginning, it's gonna be pretty nerve-wracking, but just go in there with confidence, knowing that you're gonna hit it all the time. If you're a new nurse or just a nurse wanting to start an IV, be confident. That's what they don't teach you in school. They don't teach you how to bring the attitude to the patients and how to approach it, because your patients are human beings and they can feel the vibe. If you're nervous, they're nervous. If you're scared, they'll be scared. But if you're confident, I'm telling you, they're gonna trust you. Alright? So good luck out there.